Hey guys, this is Travis with Beyond Bipolar Blog. I'm with my brothers today. So he saw a video from one of our subscribers. His name was
Cory.
Cory? Yeah, Cory. And he has this video called Too Much Medication. Kyle really recommended me to watch this with him. He already watched part of it, but let's get to it. I assume he's been on drug too much.
I think it's a very interesting video because I think we also came from that experience, and Travis would have a lot to say, so we'll continue it.
Hey YouTube, it's Cory. It's Wednesday afternoon, the 23rd, a little after 4:30 p.m. Trying to do a quick video here. I'm probably going to keep it short. I'm really not psyched up enough to do this video. I'm kind of sleepy and drowsy this afternoon. I normally don't do videos when I'm like this, but anyway, I just wanted to talk about my medication. I'm kind of concerned right now because I'm on a lot of medication right now. Well, actually, some people are on even more than this, so I shouldn't be complaining. But I was down to 2 medications, and I was doing quite well. But now I'm up to 4 medications. And that's because some things have been happening regarding my mental disability. I don't want to say everything that's going on lately, and I really can't say everything because it's YouTube, and they get funny when it comes to mental health stuff. So I'm going to keep it pretty censored here. But anyway, I'm on 4 medications right now. I'm on Rexulti, Wellbutrin, Visceral, and now Trileptal. And I feel I'm not happy about being on so much medication, but one thing I will say is my schizoaffective disorder is really well under control. I feel like I've been doing really good lately with my mental health. As far as the medication changes, it was necessary because I wanted to do it personally. I made the decision to do it because I don't want to end up back in the psych ward. That's my main goal in life, is to basically stay out of the psych ward. I've only been there 2 times. It was very helpful, but there's times where it gets very boring and you really don't have any freedom while you're in there. So I don't want to have to go through that again. I want to try to stay out of there. So I did make the decision, myself, after talking to my doctor about what exactly was going on with my symptoms. And the other thing is, you guys, is it's not just about me. It's also about the people around me. I want the people around me to be comfortable around me. I don't want people, in my family and my friends to be uncomfortable around me. So that is another reason why it was necessary to do this. It probably won't last forever. I'm hoping to get down to 1 or 2 medications eventually in my life when I get older. I don't know how soon that's going to happen. Right now, this is what I need. We're in a situation where right now, for the time being, this is what I need. But in the future, when my shit improves, which it probably will, it kind of goes up and down throughout time. It's so all over the place. But I can reduce my medication. I'm probably going to need something for the rest of my life, realistically speaking, because realistically speaking, a lot of the medications I'm on, I could probably get off of if I worked really, 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 really hard. But I'm definitely, at the very least, I'm going to need to have something to quiet down all the voices I hear. And I'm probably going to need that probably for the rest of my life, right up until I pass away. Because if the voices I hear get too loud, I can't function. I can't hear what the people around me are trying to say to me. So therefore I can't function. I can't hold down a job. I can't keep housing. I end up homeless. I end up in bad situations. So I end up in psych wards. So
I just want to say that I don't think it's bad to be on medications for the rest of your life. I feel like, there's this stigma if you have a mental illness that taking medications is really bad for you, but I'm more likely going to be on medication just because I don't want to be in the hospital. I don't want to fall backwards. I want to be able to keep functioning, maybe hold a job. I feel like he is maybe considering reducing his medications, but at the same time, there is such thing as not having enough. And I feel it's better to try being on more medications and reduce it later than start nothing at all and keep trying to actually function. Because if you're not on enough medication, which it's kind of not self-intuitive because you actually have to start slow and creep up to a target dose, but I still feel it's more important to try to be stable, be on more medications than be on less medications and not stable.
So that's kind of what's going on with my medication situation right now, you guys. I do think that my lifestyle changes kind of helped me a little bit too. I've talked a little bit about it in some of my other videos. I'm on a very strict diet right now, and I also started exercising recently for the first time since 2017. My goal right now is to exercise at least 3 or 4 days a week. But eventually, over time, as I gain muscle and get more in shape, I want to increase that to 5 or 6 days a week. So that's kind of what my goal is. And the diet and exercise are extremely helpful, you guys. But I'm the kind of person where with my schizoaffective disorder, I need more than that. I need more than diet and exercise. I need more than the natural holistic shit. The natural holistic shit is really good, but really, when I want real help, what really cuts it for me is the medication. So even though it sucks being on so much medication and they do have side effects, I have minimal side effects right now in this combination, so I'm going to stick with it for a while. So yeah, I don't really know where I was going with that anyway, but I just wanted to say that, the natural holistic shit, it does help, but it doesn't really cut it, especially when it comes to things like hearing voices and seeing shit that's not really there. I really need to have medication for that. It's really the only solution. So yeah, that's what's going on with me right now, you guys. I hope everybody's having a good week, and I'll try to talk to everybody soon. Make another video here, maybe next week or something. All right, guys. Bye, guys.
I agree with that. I don't think there's any holistic thing. No matter what exercises, no matter what things, there's nothing that could really prevent voice.
Hey guys, it's just me.
Is that pretty true?
I want to say it's very difficult to disassociate yourself from reality and what is like a hallucination. So I feel like if you're in self-harm and you know the medications work, keep taking medications. I wouldn't even try to force yourself to be off medications if you feel that you're not safe. I feel like medications work for me. There's a lot of people, especially in the beginning of mental health, I stated before, that they're against taking medications. They refuse it. They feel it's not working. But if you give it time, hopefully sooner or later, more likely later, that you'd be able to be more stable in the end if you find the correct type of dosage and medication that actually works for you.
Are you familiar with any of the meds you've on? Wellbutrin, I think you were.
Visceral is like an anti-anxiety medication. I used to try to take it for sleep, but I didn't find any benefits from it. And Rexulti is antipsychotic. What else did he say?
So
helps dub down the voices I hear in my head almost constantly. Last time was music. I tried to have music playing almost constantly because it kind of helped. Hey, you're happy about being on so much medication, but one thing I will, I'm on 4 medications right now. I'm on Rexulti, Wellbutrin, Visceral, and
I did take Wellbutrin. Wellbutrin is actually an antidepressant. Is typically used in conjunction with stopping smoking because I guess it's pretty good at helping people reduce smoking. I used to take it just as an antidepressant, but I was losing sleep and it wasn't enough to get recharged throughout the day. Since I have bipolar disorder, I feel like the mania was exalting it. The antidepressant Wellbutrin was exasperating it, and that's why I didn't think it helped. And though I tried to consider putting myself back on it, I never did because I felt like the Cymbalta works fine for me, and I never made a consideration to go back on it.
I feel like exercise is really important, mainly for mood, but when it comes to like hearing voices and having like actual psychosis, it would be a mistake to believe that exercise actually could prevent it.
I want to say exercise can be utilized to help mood, but it can't actually cure anything. If you're feeling really depressed and you're suicidal, why the hell would you want to think about exercising? Especially when you're that bad. I mean, it's always good to have distractions, and if you can find an activity to distract yourself, it's great. But for me, if I found a medication that worked for me, which it does, and prevents suicidal ideations in general, then I'm for sure going to try that medication, then try to force myself to not hear voices, try to force myself to not be suicidal, to try to force myself to not have these negative thoughts. I think it's just better to just try medications that might work for you and help alleviate the problems that might be associated with your life.
So I have a little bit of information about, I can relate to this because when I first started on medicine, I was actually labeled with schizoaffective disorder, like I said, whether it's delusions, whether I was just paranoid, whether I wasn't getting a lot of sleep, I used to have this preconceived thought disorder where I actually thought people were really talking about me. For some reason, if I would hear like excess noise, I would feel like that they're talking about me, that I was paranoid. So eventually I feel like I grew out of it, one with being in shape and just like growing older and just not worrying as much, and which I give credit to that. But anyway, I can relate to that because there's times where I slept like 20 hours a day. I can't remember what they all put me on. Klonopin's really, which is an anti-anxiety and addictive.
The thing
And
that
that's very scary, so I advise to not go on it as much. What were you going to say?
they put him on lithium, but that has nothing to do with psychosis. It's a mood stabilizer.
That was more for my mood. So, and again, I think I know a little bit about the antipsychotic world because I did take it for a few short time, and it does cause intense weight gain. So in the end, I think it's still good that Cory still works out, because it won't be good if you get diabetes on that. I don't know if you can get diabetes on that, but I assume you can. But anyway, there's two families for antipsychotics. One of the top benefactors, it seems to be risperidone, which is an older one. They didn't put me on that, but they actually put me on the newer Invega, which made me pretty sleepy, and it made me talk like this. And my brother would always notice that tardive dyskinesia.
You would have tardive dyskinesia.
Maybe you can explain what tardive dyskinesia is.
You'll notice in some of my videos that I have a tendency to move my mouth uncontrollably, and it's not something I usually pay attention to or I'm aware of. It just looks really stupid when I watch these videos and I see myself like chewing on something.
Chewing on air.
Just it looks stupid. Like even
I look like a monkey.
There's actually medications that help treat it, but I don't want to be on any more medications like him. I feel like if there's meds that work, I don't want to try anymore. I never tried medications for a neurological disorder. I don't know if it is a neurological
disorder. That's not true.
Disorder.
You are on antipsychotics.
Yeah, but it's not treating a spasm.
And what about that other thing where you just stare listlessly? What is that? Catatonia.
Catatonia.
Does he have that? Or you don't know?
No, I don't. Catatonic would be listless the whole time.
So another thing I wanted to mention: when is too much medication too much, and how patient should it be? Because with me, my dad kind of got sick of it, and he just took me off it. And he didn't like the psychiatrist. What's your opinion? And I know you dealt with a lot more meds. And what would you give Cory a length to try it? And that's another.
The best way to get advice is to have your peers around, your friends, family. They're able to tell whether you are personable, whether you act yourself, whether you're a better version of yourself. They need to be able to tell you. And if you don't have that, try to reach out to someone, because they are at least a therapist. They might actually be able to diagnose with you by being on too much medication. It's horrible when you're on too much medications. You get listless. You develop tardive dyskinesia, like me, if you're on, and that doesn't go away. It's involuntary. That stays with you forever. Catatonia is something that is with schizophrenics, but usually that happens if you're not on medication. That just listlessness. And there's dystonia.
What's the difference between them all?
Catatonia. There's a dystonic reaction, which I think is like.
What's the difference? They sound the same to me.
Nah, they're different. I'll have to look it up though, because I know there's a huge.
Go in here and they could see it too. Then. Catatonic, when you're
abnormal movement and behavior arising in disturbed mental state, typically schizophrenia. See, purposeless overactivity or
just staring at a wall.
Yeah, it's just staring at a wall.
What's dystonia? I thought that's the same thing.
Oh, it's different. A state of abnormal muscle span, abnormal posture, typically due to neurological side. See, I don't know. I want to say.
Are you worried about tardive dyskinesia?
I'm pretty sure I have it.
It usually affects the mouth, right?
It affects the mouth. It affects your feet. It affects your hands. dyskinesia is pretty similar to dystonia. It's just kind of involuntary muscle movement, but dystonia is more related to muscles, and it seems like tardive dyskinesia is related to neurological movement.
I was actually watching this PBS special last night. They're talking about the mental health and how they treated everyone really poorly. They treated everyone very poorly in the mental health offices. I mean, back then, I think they had syphilis, which kind of they didn't know it was a sexually transmitted disease, but it's very common in the 1990s, and it kind of exhibited kind of schizophrenic traits, interestingly enough, and it showed that a lot of the people back then weren't really treated well back then, and until it was the 1950s, till they actually developed antipsychotics to actually help people rather than confine them in asylums, which they really weren't getting help at all. I mean, they tried to pick their brain, lobotomize their brains, and it was an interesting topic, but I think medicine right now is probably a better alternative than what they did back then. You want to talk about another topic about Cory, about, I don't know if this relates bipolar, but he's a cool gay guy, but maybe you could talk about your story where a gay guy hit on you recently.
I think we should save that for another video. Is that it you want to talk about? Or
well, I don't know. I wanted to say, how long do you think you should stay on medication? What is your opinion?
My opinion needs to stay on medications as long
even
as
if he's tired.
You know, I hate to say it. If medications make you tired, it's better to be safe than sorry. I hate to admit it. When I was on Latuda, it made me very tired, but when I started exercising and did that over a longer period of time, I became more wakeful state. And
you must admit that the medicine you're on, you don't feel as much effect anymore.
And I got to be honest, I think I developed a lot of tolerance to Latuda because I'm not sleeping as much as I used to.
Is that good or bad?
Which I used to get 12, and now I'm getting 10 and haphazard sleep.
Is that good or bad?
I want to say it's better. Life is a lot better because with lithium, I'd always just knock out totally, and it's kind of nice to not have to be able to sleep all the time.
As much. So usually it wanes with. So that's the thing. So I guess it's another thing to try to stick with it. It seems like the thing is the positive things it's helping. So I think my brother's opinion is it's better
for me than not. For me, one mood stabilizer is enough. One antipsychotic is enough. One antidepressant is enough. I don't think it's necessary to be on more than that. It seems like he's on 2 of them.
4.
Now Trileptal. And on 4 medications right now. I'm on Rexulti, Wellbutrin, Visceral, and now Trileptal.
So Trileptal and Rexulti are 2 antipsychotics. I'm not quite sure.
Why does it need to be on 2? That's kind of
I'm not quite sure he's on both of them because that would make you definitely tired. But he'll have to probably dive more into that because I'm not sure why that's happening. Usually people get by with just one, and there's some people that get by with antipsychotics and they're bipolar.
You used to be on a bunch of them. What's your experience with it then? That the less is more?
I want to say less is more. It's better to not be on a whole bunch of drugs and then realize later it's causing a lot of problems. But if you know it works, then go for it.
I think mood is totally separate from hearing voices. That's like a separate thing, to be honest. That's very, very difficult to manage, and I don't think you can manage that holistic or naturally at all. So anyone that's I do 100%, 80% believe that if it relates to your mood and diet, it's good to exercise. But when it comes to, unfortunately, when it comes to hearing voices or exhibiting or having delusions, I'm not sure if exercise or natural holistic causes can actually prevent that, aside from just taking the med. So if that medicine technology exists, I say take it, and I'm glad it's working for you despite the tiredness. Is there anything else that you want to discuss about too much medications in your history or past, or any advice?
You know, I've never actually been on too much medication.
I thought you were.
No.
There was a time with me because my psychiatrist and dad got mad, and that's why I was on Klonopin, Invega, probably lithium and antidepressant. It was Zoloft, or not Zoloft. I think it was Lexapro and anxiety. So I was basically on 5, and for a person that was on that much, that was no good. If you're sleep, I'd say, what would you say that's too much sleep? 16 hours is when to address it, or
No, I still think even getting 12 hours is too much.
really? You never done
I hate
that
to
in the
say it, I
past?
get 10 hours, and I still think that's too much.
So you
On
recommend?
average, you need like 7 or 8, not 10 or 12. But
No, it's more 7 to 9.
But I still
it depends on the body.
still feel like I need that sleep in order to properly function.
But you're not sleeping. So you would say maybe if you're sleeping more than 10 hours is when to address it and talk to your psychiatrist.
I would address it. If you're sleeping longer than 10 hours, then you probably are on too much. You're not on too much medication. You're on the wrong dose, and most likely you're taking the wrong dose. I'd start with all medication. You should start up at a small dose and start slow and titrate up to a higher dose. I'm not quite sure why they put Colin such a high dose of lithium. There's obvious signs that he was over-medicated, being a zombie, slurring his words, developing the tardive dyskinesia,
Gaining weight too.
gaining weight, things like that. There's a lot of various things you got to be aware of. And
what I'm on now is I'm only on 2, and I take Ativan and it's PRN, but I rarely take it now because I struggle more with depression, like once a week or twice a week sometimes, it usually happens like in the morning where I just get really depressed for some reason and that pain in my heart. But other than that, I'm on sertraline and I'm on trazodone, which really helps me sleep. So I'm really on the really small dosage of limit because I feel like the less is more, and the psychiatrist I had before really felt like less is more, and I think they should just. Do you think that psychiatrists should test one med per time or a couple meds, or
you always want to start with one med at a time?
Oh,
that just
that's what they did with you?
Yeah, that's what they try to do.
So I hang in there, Cory. I think. What's the summary? Make a summary of what you recommend for them.
Number 1, start at a small dose and start with one medication. Number 2, if you feel like it's not working for you, you want to increase the dosage. And if you're sleepy, well, I guess it's better to be safe than sorry. So in a way, you'll have to manage things, whether it could be your diet, getting more exercise, forcing yourself to do things. I know it sounds horrible, it sounds torturous, but once you get into that habit, things do get easier, and it's like clockwork. There's some people that have angst against coffee, but for me, I feel like it helps me get some.
I like coffee.
It helps wake me up, and it tastes pretty good with creamer, so I don't have any issues with that.
So I recommend coffee trying to wake up. I mean, even though I still get dreary just now even.
I hate getting up early. I'd be honest with you. I hate it. I don't maybe get up at 10 or 11, but nothing earlier than that.
So I guess we recommend coffee, and then maybe maybe the symptoms of your meds will actually decrease over time. So I think all you need right now is patience, man. So we actually know Cory a little bit. We talk on Facebook and Messenger. So if you like this video and you want to know more education and some experiences about mental health and the mental health journey, I've been through it, and my brother especially been through it all. So if you're interested, you could subscribe, like, and comment on our channel if you like, and hit the bell button for future updates. Thanks, guys.
All right, take care. Have a good one. Bye.